Hello, my name is Annie Brock. I'm an Army veteran. My husband Jeff retired from the Air Force. Between us, we served on active duty for 32 years. We have two adult daughters and a son in law. I'm here today in support of HR 475 to improve the TRICARE Young Adult Program. I'm thankful to Mrs. Luria and Mr. Waltz and their co-sponsors for introducing this legislation. It's been a very long time in coming. My family won't benefit from it, but it's something that would have made a positive difference for us when our daughters were 24 to 26 years old. And I'm happy to share our experience so you understand why it needs to be passed. In 2014, while our non-military friends and family members covered their young adult children at a minimal additional cost under their regular family health care policy, my husband and I paid $156 per month for daughter number one. Over the next 2 years, the premium increased by 50% each year. When daughter number two turned 24, we started also paying the monthly premium for her. There were 4 months when we paid for both daughters, over $600 each of those months. In the final year that daughter number two was eligible, her university coverage as a graduate student became cheaper, so we moved her to that policy. I did the math. It cost over $13,000 in TRICARE young adult premiums over those 5 years. I know of one retired military family that was forced to tell their daughter that they financially couldn't afford the premiums and helped her enroll in the state Medicaid program. I heard just this morning from a family about their 21-year-old college student daughter who had an accident this past fall. She suffered a brain injury and had to withdraw from college, making her ineligible for their regular family TRICARE. In addition to the monthly premium they were required to pay immediately, they also had to pay the catastrophic cap. If they were a civilian family, they could have put their full focus on their daughter. Because they are a military family, they had to focus first on sending nearly $4,000 to TRICARE, then they could focus on their daughter. Today, military families are paying $459 per month per child. The premiums have increased 40% over the last 3 years. And on top of the outrageous premiums, the copays for TRICARE young adult are higher than the family TRICARE Prime copays. My family won't benefit from this legislation, but the military is one team. Regardless of service or era, we are bound to the families on our right and left, in front of us and behind us. We must be faithful to each other. So enough is enough. As military families, we make many sacrifices to serve our nation. There is no reason we should be financially penalized in a way that other American families are not. So I beg of you, we need your help to get this legislation through to the finish line. Please support it. Thank you.